Sanna Khalil lies in a hospital bed at Jabal Amal Hospital in Tyre. Her legs were amputated after an Israeli drone strike.
My husband, my daughter, my son-in-law, and I went out to work in a banana plantation. At around 10 o'clock, we were hit by a drone. It knocked us off our feet, and I lost my consciousness.
She is one of the thousands of casualties pouring into hospitals in southern Lebanon, where medical facilities are now buckling under the strain of war injuries and health problems caused by mass displacement. The burden comes as intense Israeli strikes persist in the country's south, despite an extended ceasefire.
We are dealing with 70% of inpatients with various diseases. We are treating them in order to steadfast together. Unfortunately, there was a lot of suffering and the strikes were severe, more than the war in 2024. We could hear strikes around us. They were much more severe. The wounded were arriving, and I don't know how to say it in Arabic. I mean, they came in pieces.
Dr. Marwa says the hospital is providing care for around 75,000 displaced people who are stuck in Tyre, on top of treating those who are wounded. Dozens of people have been killed and wounded since Friday, including in Nabatiyeh and Bint Jbeil districts. The death toll has now reached over 2,600, while more than 8,000 others have been injured since the war began on March the 2nd. Meanwhile, in Beirut on Saturday, Lebanon's army chief Rudolf Haikil met with U.S. General Joseph Clearfield, who heads the committee monitoring the ceasefire. The meeting addressed Lebanon's security concerns and support needed by its military. At the same time, Hezbollah says there is no real ceasefire. The group urged Lebanon's army to take more decisive action over what it calls violations of the truce. For patients like Sanna, the war is something they will remember for the rest of their lives, while hospitals like Jabal Amil work around the clock to help others like her. Zama Luthuli, TRT World.